Good evening and thanks for joining us. We begin with the fast evolving developments of the COVID-19 outbreak. Action is now being taken to try to limit the impact on the global economy. The U.S. central bank slashed its benchmark interest rate by 0.5 percentage point today, the biggest one-time rate cut since the 2008 financial crisis. That didn't do anything to calm the markets, though. The Dow Jones closed down almost 800 points, and there's a new warning the virus could cut global economic growth in half. Today, finance ministers and central bankers from the world's advanced economies, including Canada, held an emergency conference call to coordinate a response. Prime Minister Justin Trudeau is reassuring Canadians.
We recognize the very real economic impacts of the coronavirus globally. We also recognize that there will be impacts on Canadian businesses, on Canadian entrepreneurs, and we will always look for ways to minimize that impact and perhaps give help where help is needed.
There are 6 new confirmed cases in Canada today. The total is now 33. All of them are in Ontario and BC, except for one in Quebec, and all are connected to travel from other countries. The global number of confirmed cases has now surpassed 92,000. More than 3,100 people have died. The World Health Organization says that puts the world in uncharted territory. It says the mortality rate from this virus appears to be more than 3%, and that's much higher than seasonal flu, which kills far fewer than 1% of people affected. In tonight's top story, Couteur looks at preparations underway here in Canada for a potential spread.
It's the next stage in the fight against COVID-19. Toronto area transit agencies have started disinfecting buses and trains daily to stop any spread of the novel coronavirus.
We piloted a special long-acting antimicrobial agent on a train. It was quite successful.
It's an additional measure at a time when the federal health minister continues to say the current response is working.
Federal government works very closely with provincial and territorial partners on all kinds of different technical governing bodies that help make sure that our systems are ready should we see an outbreak in any community.
They say they're ready, but they've yet to lay out a battle plan for a possible outbreak in the way other countries have. So, what's Canada's plan?
The basic plan that I understand is the pandemic influenza plan that will be adapted nationwide to deal with this.
Now, Dr. St. John helped to develop the influenza plan after the SARS outbreak in 2003. He says it's not time to implement it, but it is time to explain it to Canadians.
I think it would give people a sense that number one, there is a plan. Number two, it is a multiple component plan. It deals with the private sector. It deals with security sectors like police, fire, ambulance.
He says public health officials are trying to strike the delicate balance between informing the public and causing panic. So far, all of Canada's COVID-19 cases are travel-related, not spread within communities. And that's why some don't think the federal or provincial governments need to take possible next steps.
Each province has health protection legislation that enables medical officers of health to put a person into quarantine if they suspect that they may be developing a disease.
It's an extreme power that could be used to fight a virus which is spreading extremely quickly. Couteur, Global News, Ottawa.